I'm actually going to introduce our next speaker, Dr. Melady Preece. She is a specialist in health psychology, and she works with our program at VGH, in transplant, obviously. We've spent so much time focusing on how to better care for our patients, and Dr. Preece is going to teach us how to take care of ourselves today.
Hi.
Welcome.
Hi there. It's wonderful to be in a room full of people who care about helping others. However, there's some dangers to being a helper, and that's what I'm going to try to talk about a little bit today. So something that there's my talk. Stress, compassion, fatigue, and vicarious trauma. I will define later. Those things have an effect on us, and we have to be aware of them. I don't know if any of this looks familiar to you, but most of us, I think, find that there's a lot of stress in our workplace. It's part of the nature of our work. It seems like workloads increase, salaries don't. We're asked to do more with less. Sound familiar to you? More paperwork, more record keeping. We're also exposed to really traumatic and difficult situations that really tug at our heartstrings and can really affect us even after we go home. Often we're faced with these moral and ethical dilemmas that impact people's lives, and they can be very difficult for us to work through. Sometimes we have to work with colleagues who are kind of cynical and burned out, and that can have a contagious effect if we're not careful. And, we work in oceans of pain. We work with people who are struggling all the time. And that has an impact on us. And if we're not careful about how we manage those stressors in our work, we can end up in that little pit there, the pit of depression and hopelessness, which is a hard place to get out of. Much better if we can avoid getting there. So, lots of research has been done on the cost of caring. It's important to sort of distinguish between the different ways that we're impacted, because depending on how we're impacted, the things we need to do to protect ourselves are different. So compassion fatigue is just that feeling, I'm sure you know it, of just emotional and physical exhaustion that we can sometimes feel. It's not a mental illness, it's an occupational hazard. It's nothing to be ashamed of. It happens to all of us to some degree. Vicarious trauma, on the other hand, is a little different and is more the impact that hearing many, many traumatic stories, seeing sometimes traumatic events happen, that cumulative experience can have an effect on how we see the world. We are more aware of chronic illness and the devastating things that can happen to people than the average person walking down the street. And that can affect the way we think. We can start to think about our world as being a dangerous place. So we have to also consider that aspect. Burnout is another thing that can happen. That can happen to everyone. You don't have to be in a helping profession. That's really just that feeling of stress and frustration that we get when we feel that too much is expected of us. Our workloads are not realistic, and we're not getting the support that we need from our employers. But we can have all of these together, even. So I guess, a lot of people who work in helping professions came into this kind of work because we want to help. We want to make a difference. We really care about our fellow man, which is wonderful. And being in a helping profession is a way to satisfy that desire to be a help. However, the more that we care, the more vulnerable we are to developing this compassion fatigue. There's other things that make us more vulnerable. Many people have a traumatic history of their own, some traumatic event in their past which they have recovered from, but can still make you more vulnerable to hearing more traumatic stories. They've done lots of research looking at nurses and their health. This is just one example. There's many others, studies that show that healthcare workers do tend, they say about 50% probably are suffering from compassion fatigue at any one time. Certainly depression and absenteeism are more of an issue for people in helping professions than in other kinds of work because of this, drain of just being present for people who are suffering and struggling. We never really talk much about receptionists and administrative assistants who are often the ones who are at the front line and get those calls from irate or upset clients, and they often don't get support from each other or from the people that they're working with. So we have to consider them as well. Now, of course, there are some programs, employers will offer wellness workshops, and EFAPs are available to us. Not everyone takes advantage of those. In fact, it seems like not a lot of people probably do. So I would like to propose that we need to become more aware of our own personal level of compassion fatigue at any time. And so we need to have some kind of warning system. I think everyone has different sort of indications. I know I have my own personal indications, like, uh-oh, I need to take a break because things are just sort of starting to ramp up. So we can think about the low level of compassion fatigue. That would be like when you come back from a 2-week vacation, maybe? Well, or maybe not if your desk is piled this high, but that feeling of just feeling really refreshed and ready to go. Most of us don't stay there very long. I think most of us are in the normal, the yellow, where we have some degree of stress on a daily basis. We are being challenged daily with things that we're working with, but we're coping, we're managing. However, there are times, for a variety of reasons, where we may start to tip into the orange and red zone. And we need to know what it is to watch for so that we can be aware of when we're being impacted. Warning signs might be things like, those mornings where you wake up and you think, could I call in sick? That would be nice, And then you go, no, can't, gotta get up. But having that thought, the fact that you think that is an indication that maybe you are getting a little into the orange zone. Often things like avoiding friends because you feel too drained to really talk to anyone at the end of the day. You've talked to people all day long and now you just want to be alone. Maybe stopping exercising if you have an exercise program and you just kind of peters out. That's another maybe warning sign. Avoiding returning phone calls. Compassion fatigue makes us want to detach from other people, and that often includes our family and friends before our patients. It is our colleagues, our family, who suffer from our own compassion fatigue, that we just don't have anything left for our life outside of work. So those are things that you might want to pay attention to. I'm going to go some more into some of the different kinds of symptoms that might give you an indication that you are struggling with some of these things or being impacted. Physical exhaustion is definitely one. When you go to work on Monday morning and you're like already tired? It's not good. It means that you're depleted. You are not, you're not using your break is not enough for you to get back to feeling energized. Trouble is when you're depleted, you kind of lose your sense of humor, If you're just tired, you can just sort of slow things down a bit. Depleted is kind of different. You kind of lose that part of yourself that enjoys living. Not so good. Often we'll notice, sleep problems, of course, is always an indication of something. Headaches, people have migraines, somatization, just like, you just don't feel good, like feel kind of achy, and your stomach doesn't feel quite right, and you have maybe a tension headache. Those can all also be physical signs that perhaps compassion fatigue is veering into the orange zone. Then often we catch ourselves behaving in ways that we know aren't really the best. Like having a drink every night as soon as you get home, and not just one. That's something that you might want to consider as a indication that you're not coping with this as well as you need to. Other shopping is nice, but if you notice that these things are becoming compulsive and detrimental to your well-being, yes, just missing work a lot is also something that makes you think. Forgetfulness. This is one that gets me. I notice, like, oh my God, I completely forgot about that. And I go like, wow, I don't usually forget things completely. So that's a sign for me that I'm just getting a little bit too stressed out. Anger and irritability is something that we all experience from time to time. Often we can start expressing that towards our friends, our family, our colleagues. So some of us are, we know that we're not supposed to do that, and we keep it in, but we still feel it. And those feelings of irritability are something that we need to pay attention to. Like feeling irritated when patients don't show up for their appointments, right? Or feeling unempathic towards there's always some patients who tend to take a lot more of your energy and time. They're needier, they have more questions, they call more. And when you start to feel kind of annoyed and irritated by that, that's another something to kind of pay attention to. A fun thing for you to do might be to just, if you notice that feeling of irritability is something that strikes you a lot, just take a note each day, for a day, of every time that you feel irritated about something. And you can use that as a warning sign. I would say more than once is not good. Often we'll tend, when we're feeling this overwhelmed feeling, to try to avoid difficult patients, get somebody else to deal with them. Also this, when people are sometimes talking to us and telling us about their issues and their distress, when we're really struggling with compassion fatigue, we might notice ourselves kind of just shutting them down, like, giving them some kind of pat answer, trying to minimize their concerns, and just really sort of faking interest rather than having a genuine interest in their well-being. I experienced a great deal of pain preparing for this talk, I must tell you, because I'm like, oh God, I do that, I think we need to really sort of acknowledge that this is something that happens. We're human, and we have these feelings. And it's more that we can talk about it and be more aware of it. So the psychological symptoms, emotional exhaustion, certainly. This exaggerated sense of responsibility can be an early warning sign, too. This kind of feeling like I have to do it, nobody else can. I have to fix all of these things myself is kind of concerning, because we know we can't do that. The distancing, that realizing that you're really not interested in talking to your family or your friends about their issues. You just want to be quiet, stare at the television, It's not a good sign. So what happens with compassion fatigue is we lose this ability to feel sympathy and empathy for other people. We feel kind of numb and detached. It's not a happy way to live one's life. Often we can struggle with our feelings about ourselves too, feeling like we're not doing a good enough job, we're not a good enough friend, a good enough parent, that we can just sort of get down on ourselves. And of course, depression is something that we can experience periods of low mood, feelings of hopelessness or guilt. Cynicism and embitterment are ones that I really like. Those are considered, I was very pleased to read that people consider that a sophisticated coping strategy. Not a good one, but a sophisticated one. So you can take some comfort there. But you know, when we have those moments where we just really feel cynical towards patients, often we'll have colleagues who are very cynical about other patients, and that is also wearing on us. But really, those feelings, cynicism, and also resentment of feeling like there's too many demands on you at work or at home. Those feelings of resentment they eat away at you. They really kind of destroy our ability to enjoy our life because we carry those with us. They just kind of fester in there. This disruption of a worldview is something that we really have to guard against. I certainly have become hyper aware of my health since working in the transplant program. You know, you just hear so many things that have happened to people that you can't help but to think, oh, these things can happen. They could happen to me. They could happen to somebody I love. And so we have this feeling like our worldview changes, that we're more aware of unpleasant experiences that can happen to people. So, I mean, most of us, we're professionals. We cope pretty well with these kinds of stressors most of the time. But there are things that can contribute to us developing compassion fatigue over and above like our background history. But say we have a family member who's ill, or we're grieving over a loss of somebody, or we're going through a divorce. These personal stressors make us more vulnerable to problems with compassion fatigue. And then our working conditions. If our working conditions are very frustrating, if we're going through big changes in processes, systems, paperwork. In some workplaces, people don't feel a lot of trust in the administration to take care of their needs, and they begin to feel like they can't go to anyone for help. These are things that can increase our tipping over into the orange. I would like to talk a little bit about this, the toxic workplace thing. It's really easy to blame all of our problems on the system, which is composed of people, right? Like us, people like us. And I think that having a feeling of mistrust and putting our uncomfortable feelings about our work onto some sort of unknown system really doesn't help us feel any better, and it does increase that feeling of mistrust and hopelessness also. We can get really locked into this negative frame of mind about it, like, oh, there's nothing we can do, it's just awful, We need to believe in our ability to affect change, to improve our workplace conditions, and we are people, and individuals make up the system that we work in, and we can always do things to improve the social atmosphere, the way we interact with colleagues, and the way we interact with our supervisors, and really improve the workplace if we're not happy with how it is. It takes a lot of energy, I know. But we could all do a little bit. We could smile at each other. There's a start, I love the people who come in the morning. Good morning, how are you? With a nice smile. It helps. So here's my compassion fatigue dragons. Aren't they lovely? I think if we could think of our colleagues as each having a dragon on their shoulder, just like in Game of Thrones, you know. And, you know, sometimes the dragon is nice and green after vacation. The yellow dragon is like, okay, we're doing this, we're dealing. And then there's the red dragon who's cranky, irritated, resentful, and embittered. And when we look at our colleagues and we work with our colleagues and we see them kind of just acting a little bit, you know, not the way they usually do, to remember, oh, that's probably maybe what's going on with them. Their dragon is red today. And not taking it personally, giving them a little space, and who knows, maybe even giving them a little support. Because we all have days where our red dragon comes out. We know we do. So what can help us? Well, on a professional level, I think it's really important to acknowledge that compassion fatigue happens. And we can normalize that for each other. We can understand, yes, there are days on which you feel a little irritated by the people that you're trying to help. And that means that you need to take care of yourself a little bit. It doesn't make you a bad person. It doesn't make you a bad professional. It's just something that happens to us in our profession. And so talk to your colleagues about compassion fatigue and those moments where the way you're feeling is not really the way you would like to feel. And you can find that you can actually support each other to get through those times. On an organizational level, you know, these are the obvious things that we can all do. A lot of us don't. I see people around me don't. Having regular breaks is really smart. Don't eat at your desk. Mental health days would be nice. I don't know about you, but you know, you have a list of people waiting to see you. If you want to take a mental health day, it's going to cause some havoc at work. But if you can have a mental health day, that's a nice thing. Peer support, I think, is something that we can all implement for each other. And peer support, you know, is not getting together and complaining about the system or how hard you're working, right? That's not support. That's kind of encouraging the cynicism and embitterment. But peer support in the like, what can I do to help? Listen, why don't we just go for a nice walk at lunch and go out for tea or something? You know, just to help people remind them to take those breaks. Often there are ways, if your workload is over what you can manage, to discuss that and to try to figure out ways to adjust workloads. Certainly having access to professional development like today is a really good thing. It's kind of a nourishing activity for us in our professional lives. We can't just give. We need to also replenish and be inspired and encouraged and go back full of renewed vigor. On a personal level, it's really a good idea to get in the habit of checking in with yourself. How am I doing? Am I feeling okay? You know, I always do it when I'm waiting for elevators, because it seems like I spend a lot of time at work waiting for elevators anyway. So I just go, oh yeah, how am I doing? Am I okay? Am I tense? Am I feeling relaxed? Am I all right? But it's really important to take those moments whenever you do it. And check and see, like, are there nourishing activities in your life? Are you just giving? Are you feeling just constantly being depleted and not getting anything back? Are you one of those people who takes care of everyone? There are people like this, and it's overwhelming, I'm sure. They're a caregiver at work, they go home, they have children, perhaps they have a family member who has health issues, and they're just taking care of people all the time. You need a little time for yourself also. You can check in on how you're doing with alcohol and food and gambling, I don't know, shopping, all of these things. And be aware of your stress signals. And notice if you're sabotaging your self-care. I mean, there's lots of people who go, oh, come on, I don't have time for that. I can't exercise, that's ridiculous. You know, I have to do this, I have to do that, I have to do this. that's kind of self-sabotage in a way, because that doesn't help. So we want to stay afloat. We want to be able to get through this, you know? And I like this little boat. It reminds me of how it feels some days, you know? Got to stay above the waves. So these are some nice principles that were written. Somebody was talking about having the attitude to have if you're a helper. And they talk about developing this intentionality and maintaining an intentionality through a non-anxious presence in both personal and professional spheres of life. So intentionality is that sense of having kind of a calm, focus, purposeful attitude. Like you know what you need to do, you maintain that kind of overview of where you're going, why you're going there. The non-anxious part is just being able to be exposed to another's pain and suffering, to be able to express empathy and compassion without taking on their pain. And this requires you to kind of be able to be in the present moment, to be aware of yourself, to be aware of your own physical presence, and allow yourself to express that compassion. Breathing helps too. I always remind you to breathe. And the second principle that I also really like is this development and maintenance of self-validation, especially self-validated caregiving. So the idea behind this is to engage in self-care in a way that is guilt-free. So it's prioritized. It's really part of your professional obligation so that you can remain healthy while you're doing difficult work. So we can work towards that. A toolkit for you, perhaps. When you notice yourself kind of getting into the orange, know your warning signs, know what they are. Schedule those regular check-ins with yourself. You know, when you come into work in the morning, how am I feeling today? In the middle of the afternoon, you know, am I all right? Am I still maintaining? And have kind of things that you can do depending upon what's going on. Stress relief strategies are, just things like having a bath, going for a massage, taking a long walk, just doing some sort of emergency thing that you can do when you get home at night to help yourself maintain your well-being under stress. Stress reduction strategies involves really assessing how many things you have to deal with that are stressful and thinking of ways that you might be able to cut back on some of the areas that are stressful for you just to reduce your overall stress. Stress resiliency, that's something that we hopefully are all aiming for, which involves kind of regular practice that just lowers raises your threshold for tipping into compassion fatigue. Things like meditation, things like yoga, breathing exercises, any kind of exercise really, things that just make you a healthier person so that the stress does not impact you as quickly is a great long-term way to go. Given that helpers are not good at taking care of themselves in general, not all of you, I think it's about 60% of you are much better at taking care of other people than you are taking care of yourself. At least that's what the studies show. There's a lovely Standards of Self-Care Guidelines that was published by the Green Cross Academy of Traumatology. And I find this very helpful to read, perhaps when I'm busy making excuses for why I don't have time to take care of myself. And they really propose it as like part of our professional obligation as a helping person to follow these self-care guidelines. So the principles are: do no harm to yourself when you are helping and treating others, and attend to your own physical, social, emotional, and spiritual needs as a way of ensuring that you can provide high quality service for those who look to you for help and support. Isn't that nice? I'm going to put that on my mirror, I think. And to think of this as really sort of an ethical obligation that we have to respect ourselves, respect our own dignity and worth, and honor that within ourselves. Take responsibility for self-care and acknowledge that there's no situation or person that can justify neglecting our own well-being. And that our duty to perform in our roles as a helper is also part of that, is a duty to self-care. And to just, as a helper, it helps me to have it all written down, like, oh, I'm supposed to do this, okay. So, if you want to start now on improving your wellness, the first thing you do is you take stock of all your stressors, look for ways to enhance your self-care, make a commitment, and think about how you can develop long-term resiliency. So first, take stock of your stressors. Most people I know are doing way too much. Oh, my plate's too full, you know. And then there's a whole list of things on the sides of the plate, on the table, that they would really like to do, but they can't figure out how. And often we tend to get into all or nothing thinking, and we think, well, I can't stop doing this, I have to do this, like feed my children, for example. Have to do this. Don't have time for these other things I would like to do, like take a walk, whatever. But if we can stop the all or none thinking and instead think, how can I like shave a little piece off of one of these obligations that I have? Just shave a little bit of room, you know, give myself maybe 1 or 2% room to do something for myself. You can get creative about it. Teach the kids to cook. That'd be good. There's always a way that you can, you know, try to reduce your stressors a little bit. Of course, we all know we're supposed to take care of ourselves. Sleep, rest, proper diet, exercise, vacations, all of these things are essential. But there's also our psychological state, our spiritual well-being, and keeping that balance. So our goal should be to balance all of these things that we are responsible for. Psychologically, taking time for self-reflection is really essential. Whether it's like take a half a day a week where you just have yourself to account to and think about how you're doing. One thing that is really helpful in terms of finding some nourishing activities is to, you know, engage your intelligence in some other area, something that is interesting to you, like theater, art, or music. Learn also how to say no to extra responsibilities, and practice kind of some loving kindness towards yourself. Some of us have a critical voice in our head, you know, that's like, oh, you should have done better at that, and you shouldn't have done that. And this is not a helpful thing to carry with you all day. There's a much nicer voice that you can develop. One that goes, that's okay, hon, you did your best, it wasn't great, but tomorrow maybe you'll do better, you know, and just get in the habit of just being a little kinder to yourself. Allow yourself to express your emotions. We like to laugh, sing, cry. These are good. We need to let this stuff out. Anger, not so much. But there are ways that you can transform your anger into something that is useful. You know, write letters to the editor. Join an organization that's trying to make a change in something. Somehow use your frustration at things you don't like in this world and use the energy that comes with anger to to do something, to do your little bit, to make yourself feel more comfortable about it all. So paying attention to your thoughts, your beliefs, your attitudes, your feelings. Some people find it hard to engage in self-reflection on their own. Some people like to write in a journal. It can be a really useful way to just kind of spend a few minutes each day writing down how you're feeling and what you're thinking about. Some people like to go to a therapist. It's just kind of like a scheduled self-reflection appointment, and they're very good at helping you do that, so that's a nice thing. Your spiritual needs, everyone has their own way of taking care of those, but seek experiences of awe, the AWE kind. Being out in nature always does it for me. Being somewhere beautiful, looking at art, beautiful art, anything that just gives you that kind of lift and inspiration helps to balance the depletion you might be feeling at work. That's it. And of course, in the workplace, you can do things like make your workspace comfortable and comforting to you. Try to balance your workload. Maybe have a work project that's kind of exciting or interesting to you to balance some of the things you don't enjoy so much. And take time to chat with your coworkers. Develop, nice collegial relationships with them. They can really be a big support to you. Okay, so I'm getting down. So, here, I wanted to say, some people have a hard time making commitments for self-care particularly, because, we need to acknowledge that maybe this is something that goes by the wayside. So make a formal commitment. Write down some tangible goals. Maybe even tell someone. Tell them, could you check back with me in a month and see if I've done any of these things? Sometimes that makes it a little easier to do. I'm going to flip through this. I was going to talk about mindfulness-based stress reduction, but there are multiple ways to improve your well-being. You can go on YouTube and Google body scan, meditation. Lie down and listen to one instead of listening to your own thoughts attacking you or criticizing you for not having done everything. And just learn to have a way of finding some peace. And I like this about when you go to work in the morning, perhaps just remind yourself, why am I doing this work? What are the rewards I get from this work? There are a lot of rewards, and most of us are very lucky in the work that we do. Here's a nice example of resiliency. I love this picture. These are nurses in London after a bomb was dropped on the hospital. No one was hurt, but I just love the looks on their faces, They're like, okay, what's next, It's that's how we all want to be, right? That's how I want to be. It's like, okay, just take it in stride and move on. So that's the goal of resiliency. Well, thanks very much. Now I wanted to, how do I find out about questions? Oh, I only have one question. Are there any out loud questions? No? You're all shy, huh? So, okay, any suggestions for stress reduction while on the job and stress levels are rising? Yes. Close the door if you can. Get away from everyone if you can. If you can't, just breathe. Just go, okay, this is getting to be too much. Breathe out first, because that's the effortful part. And even with breathing out, you can think about your body relaxing. And then just take in a few breaths slowly, deeply, and say something kind to yourself, like, it's okay, darling, you're doing just fine. You'll get through this. And just take that moment for yourself. If you have a little longer, there's a really cute 1-minute meditation on YouTube. You can always click it on your computer. 1 minute's not very long, but it makes an enormous difference to how you feel, just taking that moment to really relax and encourage yourself. Okay? I guess that's it.
I'd like to thank Dr. Preece for coming and talking to us today.